about our citywide mask mandate. I think most people realize that we've had mandatory mask wearing indoors, at least in public spaces, now for some time, since we're way back in Delta. And so a big milestone for us. We have decided that on March 1 that the mask mandate for Winston-Salem will be rescinded. I think you'll see mask mandates in other areas and drop in about the same time, and we'll talk about that in a minute. So everyone's going to ask me, what do you think about that, Dr. Ohl? And I said, I think it's okay. I mean, the mayor and I talked about it. And I think it's okay for the following reasons. One is our case counts are coming down. At 43 today, we're going down by about 7 a day. So by March 1, we should be in a much more comfortable range for the number of cases being transmitted in the Triad area. Number two is that the end of February, first part of March is when our respiratory viral season usually winds down. So influenza, other viruses, paraflu, RSV, all those little nasty bugs that like to make us miserable with coughs and colds tend to start going down roughly at about the same time frame. And the weather warms up. Yes, it will warm up. I've been told by my weather colleagues that it is coming. So people spend more time outdoors rather than indoors. Humidity goes up a bit, temperature goes up a bit, the virus doesn't do as well quite as much in those situations. And then lastly, N95s are ubiquitous now, and people can get them. And I'll tell people what to do with those in a minute. And then we have more treatments coming online. This week, the state cut out a lot of the restrictions on using sitoramab, which is one of our monoclonal antibodies that works against Omicron. We have a better supply of it now, so it's more widely available for people with underlying health conditions, including those with diabetes, heart disease, lung disease, kidney disease, as well as immunocompromised patients, cancer patients and such. So we have more treatments available. Paxlovid, the oral treatment's also becoming more available. So as treatments become more available, then we can give effective treatment to people who are at higher risk of having complications of COVID, which reduces the impact of the virus. So lots of reasons that we can drop our mask mandate for indoor spaces. Now, having said that, while the mandate may be dropped, it doesn't mean that wearing a mask at times still might be a good idea. And let's go through a few of those when you still might want to wear a mask. Because masks do work. N95s work very well for personal protection. To show you how well they work, when I see a patient with COVID, I put an N95 on and I can look down on that patient and they can breathe right on me and breathe the virus all over them. And if I have an N95 and I wash my hands and I have something in front of my eyes as well, I don't get COVID. And so if they work for those of us in healthcare actually taking care of COVID patients, they're certainly going to work for you out in the community. KN95s are just as good as long as you don't get a counterfeit one. There's a few of those out on the internet, so you have to be a bit careful. And so a high-grade medical mask could be worn if you are, say, more vulnerable. Let's say you have an immunocompromising condition. You can talk with your doctor if you're on that list or not. If you have other underlying health problems that make you at higher risk of having a complication with COVID, heart disease, lung disease, kidney disease, so on and so forth, had a stroke, those would be people who still might want to wear a mask. And people over the age of 75 might want to wear a mask, particularly when going out in public areas, particularly in areas that are crowded. So I don't think I have to go through a lot of examples about crowded situations, but let's say you're going to your kids' championship basketball game and the bleachers are packed. That's a crowded situation. You may want to wear a mask. Church, Easter Sunday, church is packed, pews are crowded. You might want to wear a mask in that situation.